Welcome to this webinar on NIS, a tool developed by the Red Cross Red Crescent movement to support community-based surveillance. NIS has been built over a long period of time, with 5 codathons and multiple Red Cross Red Crescent national societies inputting into its development. NIS allows us to remove the need to fill in information and data manually from submission platforms such as ODK and Kobo. It also allows for automatic data analysis. Therefore, NIS reduces the risk of errors while improving timeliness. Throughout this webinar, we are going to guide you through the basics of community-based surveillance and NIS, as well as introduce you to the NIS platform itself. Please remember that before using NIS, it is important to complete an assessment in order to determine its need and feasibility. For elements to include in your assessment, please refer to the IFRC assessment tool, which can be found on the IFRC CBS website. Community-based surveillance is the systematic detection and reporting of significant public health events within a community by community members. There are several reasons that we need community-based surveillance. These can include remote and hard-to-reach locations, understaffed health services, a lack of trust and/or knowledge within communities, the collapse of existing surveillance systems or health services in the case of a conflict or a natural disaster. CBS is a good fit for the Red Cross Red Crescent movement due to its extensive volunteer network, who live in the communities they serve, making them ideally placed for early detection and response. As most volunteers are not clinically trained, we have developed a syndronic surveillance strategy that allows for volunteers to report based on simple community case definitions. Our community case definitions are by default based on WHO guidelines and can be adapted if needed after discussions with Ministry of Health and Country and with other stakeholders. These community-based definitions are often indicator-based, using signs and symptoms, but also exist for event-based indicators. For example, a cluster of deaths in the community. Our community case definitions include both human and animal health events. To be relevant, Red Cross Red Crescent national societies work with their ministries of health to develop a list of priority epidemic-prone health events to include in their CBS systems. So what exactly is NIS? It is a tool to implement CBS, and it has been used by Red Cross Red Crescent national societies. NIS was developed by the Norwegian Red Cross, Belgian Red Cross, and IFRC, and is tailored to the needs of the movement for CBS. It has real-time reporting directly from communities, real-time analysis, and rapid notification to Ministry of Health and other partners. It allows for early response to save lives. And lastly, NIS is an SMS-based tool. Volunteers report into NIS via SMS and receive feedback messages in return. How can one access NIS? The Norwegian Red Cross team will provide access to any Red Cross Red Crescent national society looking to implement community-based surveillance, and will help set up the account. Trainings and troubleshooting are also included in the services provided by the Norwegian Red Cross. NIS is a cloud-based platform. It does not use a local server. Data protection is of paramount importance, and NIS maintains compliance with RGPD security.
Before we start on presentation of NIS, we just wanted to say a few words on the information flow. Imagine a network of community volunteers spread across the country. When something unusual happens, a sudden illness or a cluster of symptoms or whatever, they quickly report it to their supervisor. The supervisor checks the detail and, if it's a true alert, contacts the local health authorities. All of this flows smoothly because community-based surveillance and the CBS tool NIS are designed to extend and be integrated into the national surveillance system. It can even interoperate with other platforms like DHIS2 or EIDSR or whatever. So once the alert is confirmed, the national system immediately shares it timely with authorities and the partners to launch an adequate response. Hello everyone. In this session, we want to talk about different functionalities inside NIS application. For this purpose, we are using test environment of NIS application with this address, test.rcnis.org. We already have an account for a test manager, and we are using that to log in inside NIS test environment. After entering information, login, the first thing you will see here is a list of different projects inside this National Society dashboard. So, and in left side, you can see the user currently we are using is Mary Manager, a test account, and a menu for National Society. I want to start from item setting, and this setting show all settings for National Society, for current National Society. The first item is overview, and you can see, for example, name of National Society, the country name, content, language, and other things. If you want to edit anything, you can use the edit button. You will see here, for example, name of countries. You have a list of different countries here. You will select from them. You can select content language. This language is the language for dashboard of National Society. Currently we selected English language, but in this application we are supporting English, Spanish, French, Russian, and Arabic. So we are supporting 5 different languages. We have AP week, including Monday to Sunday, Sunday to Saturday. And if we want to have DHIS2 interoperability or integration inside NIS application, we should select this item. We will talk about it later more. The next items here we have in settings menu include SMS gateway. SMS gateway is very important part in workflow of NIS application, but definition of SMS gateway should be done by administrator. So it's not job of manager. Manager can see different SMS gateways defined for this National Society. The next part is organization. If you want to use multiple organization for this dashboard, you will see different organizations here, list of them. Definition of organization is job of administrator again. The next item is geographical structure, which is very important for us. It's very simple. You will define geographical structure of your National Society here. So this is the central place. Let's say you are defining locations inside NIS application. I will show you where you are going to use these locations. It's very simple and easy. The first level of location in NIS is region. So you can say add region and entering, for example, name of region, and you will say save. You will see the region is added here. If you select added region, you can add district under region. So districts are defined under region. Very simple. Just say add district, and you can add district name here. And by selecting save, it's possible to select the defined district and say edit, for example, to remove it or edit it. If you want to edit this one, you will add whatever you want, or you remove the characters and say save. Under district we have village. Village actually is the third level of location in NIS application. So first level was region, second level district, third level village. You can say add village and enter the name for village you want to have inside NIS application. And by clicking on save, it will save here. Under village we have another level of location, which is zone having zone is completely optional in NIS application, but it's possible to add it, same as the other levels of location inside NIS application. There isn't any limitation to add regions, districts, villages, or zones inside NIS application. You can add all regions. Let's say we want to have another. And say save. And now I want to change the name of this region. I will say edit, and by clicking this pencil you can edit it very simple. For example, test region 1, and save. Inside that we had test district 1. You can have another district here on the region. So for example, test district 2, and click on save. Under districts you are going to have villages. By clicking on district you will add villages under that district. Or if you want to edit or delete or whatever you are going to do is possible here. Deleting is possible by click on edit and click on this recycle bin here. Yes, we are confirming removing, and the village is removed. Remember, having 3 levels of graphical structure is mandatory in NIS application. So for different projects you should have regions, district, and under district you should have villages, but having the zone is completely optional. On test district I want to have, I will add again the test village. And yeah, that's it. Let's return back to other item here, which is DHIS2 integration. Currently we haven't any DHIS2 integration in this National Society, so this menu is inactive. We will discuss DHIS2 integration or interoperability in other videos later. Let's start talking about users. By clicking on users, first of all, you will see a list of defined users for using this dashboard. And you can see a brief information, a table of different users predefined here. And you can see their role. We have managers, supervisors, data consumers, technical advisors, and if you want to add a new user, you will use this add button here. Adding users to National Society dashboard is responsibility of managers. So if you say add, you will see this window, very simple. First of all, remember to change the role, because based on the role some information may change here. You should add a bit more information here. If you want to add supervisor, you should have a project inside your National Society, and here you will assign the project to this supervisor. It means that the supervisor will be responsible about a project. Other information, the email here is very important. Please enter correct email address, because after entering information and clicking on add, the user will be add inside your dashboard, and an email will send to this email address, and the person should go to that email address. So that email address should be valid and accessible for the user. Otherwise, the user can't use the NIS application. The user will get an email from NIS application with a link to activating the account and selecting a password. So the email is very important. Another point here, which is important, email should be unique. It means that you can't add two different users with one email. It's not possible. So email is unique and it should be valid, remember. So you will enter information. After clicking on add, you will have the user in this table. Here you can manage the users. For example, if you have a predefined user, you can click on the user and see information and maybe change the information here and clicking on save. That's possible. The other thing you should consider here is from this table the managers can remove the users, but you should be careful. If you click on this, you will see this delete user. If I say I want to delete this user, the user will be deleted from the system, and this operation is not reversible. You can't roll back. So be careful about doing operation with different users, because if you delete a user, the user can't access the system anymore. Yeah. But by clicking on add existing, it means that a user is already exist in this application, maybe in another national society, but we want to give access to this dashboard, to this national society, to this user. So if you want to have a user with multiple access for different national societies, you will define the user just one time in a national society. In the other national societies, in the other dashboards, you will add existing user. In this case, you will enter the already exist email here. It means that we are giving that existing user access to this dashboard, to this national society. Let's talk about dashboard. This dashboard is National Society dashboard. You will see a brief, let's say, a report about different information we have inside National Society, which is very useful. But you should be very careful when you're using it, because there is a very important part on top of this page, which is filter. And the filter is based on date. For example, here you can't see any information. It seems that there isn't any information here, but there is, because you should change the date. I will return back. The default is almost 1 week, as you see here, for example, but I can return back in the time, and for example, I want to see information from 1st of July till 17th of September, or let's say to end of August. So if I select that, then you will see there are information here and a couple of charts. At the end of this page, you have generate PDF button, which is very useful, because you can have a PDF version of this page. And here you have other things as well, including how you want to see the reports, daily basis or by epi week. If you select epi weeks, it means that we want to see the charts and other things based on epi week. Status is connected to the reports. As mentioned before, the NIS application is working based on incoming reports from data collectors or volunteers. So a volunteer or a data collector is sending a report to SMS gateway number, and we are taking that report and putting it inside the NIS application in the relevant dashboard. And when you're looking at information inside the dashboard, you can filter the information based on the status of that report. We want to check, for example, not cross-checked reports. It means that we are looking for not cross-checked reports only, or we want to check kept reports. You see the numbers are changing here. Everything is changed now. This is a test environment, so many reports here are not cross-checked. This is just for demonstration, but that's okay. Let's check dismissed reports. Yeah, for that period we have just one maybe dismissed reports. You also have location here. You can change a filter based on location. Currently it's in select all situation, but you can select specific region. You remember the geographical structure of National Society, so here you can say I want to see the reports just for this region. And also you have districts, you have villages, so you can change. For example, if you want to see incoming reports for this specific village, you will select it and say show results. That's it. Be careful again, the combination of filters. First of all, the start date and end date. After that, the status of reports. After that, the location. It will be a combination of all different criteria you have here. It means that we want to check dismissed reports in this period of time for this specific area, which is just a village here. So we haven't anything. That's okay, because it's very narrow filter. But if we change it, you will see, okay, it will be a bit maybe more not dismissed reports. Let's check kept report, or not cross-checked maybe is better option. Yeah, for this area we even haven't any not cross-checked report, but that's okay. It's a test environment. You see, for example, for this area we have a couple of reports, and by changing the filter you will see the result in the information cards here, information sheets, or in the map. You will see by clicking on the map, you will see some detail about the map. You can control the map by clicking the zoom in and zoom out buttons, and you can drag the map and go to different places and check the reports. Also, you have different charts here. Yeah. The other filters here are health risks or events. You can filter based on that too. And we have two different, let's say, data collection type inside NIS application. One type is data collector. It means that a human is sending a report to the NIS application. It means that a data collector or a volunteer is sending report, or data collection points, which we are usually using for example, CCMC projects. It means that we have a specific location, and based on people who are coming to that location, we are gathering information and sending one report at the end of the day, and it will be data collection point. So you can filter based on that too. In this test project we have just data collectors, so you can say all, or you can select data collectors. Okay, so this is the dashboards and the charts you have, and information will change based on the filter. Please remember this filter part, because we have it in different places and it's working exactly in the same way. So remember the filter. The next item we want to check is all the reports. First of all, let's go to the projects. In projects, you can see list of different projects which are defined under dashboard of this National Society. It means that in one National Society you can define different projects, so there isn't any limitation for that. The project we are working on is this Mandavi test project. It's just a test project for having it for demonstration and trainings and these kind of things. So the information here is completely just for test and not real. If we go to all the reports, we will see everything regarding all projects. So if I go to all reports, I will see list of incoming reports for all projects. And you see here again, you have the filter part, start date, end date, location, health risk event, and status of an incoming report. I want to show you this report table somewhere else. It's better to go to each project and look at the incoming report for that specific project, because here we will see mix of all reports for all projects. Maybe you want to use it somewhere in some way, I don't know, but we have this functionality here. Let's go to projects, and as mentioned, the project we want to check is Mandavi test project, so I will select it. And now you will see something else here. Another menu is showing up here, and we call this menu a project menu. First of all, you will see name of National Society. After that, you will see a name of project under that National Society, and you will see the menu for the project. So we are not going to use this National Society menu anymore, so you can close it to have a bigger space here. We have different items here. The first thing we want to check is the dashboard item for project. So you will see the dashboard for this project. Again, remember, we have filter part here. So let's change the filter to have some information. For example, again, I want to go to 1st of July till end of August. I want to check everything for 2 months. And again, we have everything we had before. You have location, you have status, kept, not cross-checked, and dismissed. Something is added here, training status. And training status is important because as mentioned, the volunteers or data collectors are sending report for us. Here, some of them are trained and some of them are in training. So if we have a training somewhere in a national society, and in training data collectors or volunteers are sending report to the system, we want to know that because usually those reports are maybe not very much reliable, or by the way, you can filter based on status, training status of data collectors or volunteer. You see the information changed here. If I say trained volunteers, of course we have more trained volunteers. The other things are same as before: location, health risk event, and the data collection part, the data collection type. And here we are using data collectors. The other part of this dashboard is same as the National Society dashboard, but that National Society dashboard was overall view of all projects, but here we see the specific dashboard for this project. I think this one is more useful maybe. Again, we have generate PDF button here, so we can use it to have a PDF version of this overview for this project. After checking dashboard for this project, let's go to setting menu. First of all, we logged in as manager to this National Society. So what we see here is settings for managers, because you will see later this setting menu will change for example, supervisors. But managers can see different things here. For example, the project setting showing us some information about the project name, and it's editable, so we can change the name of project if we need to do that, and the manager should do that. In the setting we have other items. For example, we have health risk events, which is very important. Here we are adding different health risks. We want volunteer report for that specific health risk. So here you can add the list of health risks to this project. As you see, we can edit it, we can add other health risks here, we can remove already exist health risks, it's changeable. And also we have the unique code for health risks, because data collectors or volunteers are sending a report, and when they are sending a report for a health risk, they should send the code of that health risk. So the incoming report is based on the code of health risk. Here we have other information, including suggested definition, which we can change it, or suggested feedback message. And yeah, we see other health risks we already added to this project. Fever and rash, fever and yellow eyes. Again, I should repeat this sentence. It's very important. In NIS application, we are not talking about disease. We are just talking about health risks. That's it. So you can't see anything like disease here. We have acute watery diarrhea, acute diarrheal disease. All health risks which are predefined in this application are being added here based on IFRC community case definition. And we added all definitions and even feedback messages based on the IFRC community case definition. What does mean a feedback message? When a volunteer is sending a report for us based on this code, which is a health risk code, immediately we are sending a feedback message. After catching the message from the volunteer, we are sending a feedback message to the same phone number, to the same volunteer or data collector. And this message here will be the text. If for example, the volunteer sending a report for acute watery diarrhea, this will be the feedback message. Or for example, fever and rash, this will be the feedback message. So it's possible to change a feedback message here, and there isn't any limitation for that. You can enter information here in local language, for example. You can type here in Chinese language. So the feedback message which written back to the volunteer will be in Chinese language. So or Arabic language or any other languages. There isn't any limitation for that. The next item which is important here is alert rule. For example, here for fever and rash, we have alert rule, and the number of reports here is 1. When it means that when a volunteer is sending just 1 report for fever and rash to NIS application, after catching that report and processing it, of course we are returning back to the volunteer with feedback message, but automatically inside NIS application we are creating an alert. Of course, this incoming report or this alert should be cross-checked by a supervisor or a manager inside National Society. But NIS is creating alerts based on this alert rule. When the number is not 1, for example, is 2, then we should enter other information here as well. for example, time frame in days and the distance in kilometer. I will show you and talk about it later more, but for data collectors, we have an estimation location, and the location will be the area data collector is working in. That will be the village, or I don't know, will be the zone which data collector or volunteer is active inside it. Another important point here, in all defined projects, we have a health risk which is code 99, and it means zero activity or zero report. What does mean zero activity or zero report? It means that, for example, based on the project, the volunteers are sending reports on daily basis or weekly basis, or it's a convention inside National Society in training of volunteers. We will discuss about it and tell them, okay, what's the normal range to sending a report. And if they haven't any case, let's say health risk to report to NIS application, there isn't any health risk any place, so they can send a zero activity or a 99 code to NIS application, just to say that, okay, I am the volunteer, I am the data collector, and we know who is sending report because we already have the phone numbers for data collectors or volunteers. I will show you where we are adding data collectors to the projects. So we know who is sending a report based on that phone number, and this activities report or zero report shows us the person is available and he or she is working and ready to act in case of any health risk or anything. So the zero activity is for that. Yeah, that's the health risk part. So we already have something predefined for this Mandavi test project here, just for demonstration. And we have another thing here. I will jump from these two items because before talking about these two, unhandled alert notification recipient and escalated alert notification recipient, before talking about these two, I want to talk about the alerts, the data collector adding and these kind of things. Then I will come to these two items later. But we have error messages in any cases if a volunteer or data collector is sending a wrong message to the platform, because we have health risk code and they should send the code in SMS message to the NIS application, to the SMS gateway number actually. So when they are sending the report, if they are sending for example the wrong format for report, because we will discuss it. We have different type of reports inside NIS application. One of them is a simple report which includes health risk code, and the separator for reports is hashtag sign. For example, if a volunteer wants to send a fever and rash report, they will send a code for hashtag. After hashtag, they are sending the sex code or gender code. For male, it's 1. For female, it's 2. So for hashtag 1 means that we have a health risk code 4, which is a fever and rash for a male. After that, again, we are using a hashtag to send the age range. So a simple report inside NIS application has 3 parts, including health risk code, gender code, and age range code. Health risk code is clear based on added health risks to the project. They should send the report. After that, they should enter the gender code, 1 for male, 2 for female, hashtag, separator. After that, they should enter the age range. Under 5 years will be 1, 5 years old or older will be 2. So we have 3 items, and based on that we find out, okay, what does mean this health risk code and who is the person who maybe is in risk. But if they are sending the reports in wrong format, for example, they send the health risk code and gender without age, it will be a wrong format. Or they are sending a health risk code which is not defined in this project, because the health risks are defined and they should send a specific health risks for a specific projects. It's predefined based on community case definition and the assessment and the protocols for National Society. We will discuss these things later. Yeah. So these are error messages the volunteers are going to get if they are sending wrong report. So they will not find out, and they know that, okay, I sent a wrong report, I should fix it, or send another report again. This feedback message is helping a lot. Next item here we have is data collectors menu, which is very important. All operations we can do on data collector information is under this item here. For example, in data collectors collection points, if we click on that, we will see a list of defined data collector inside this project. It's important. So these data collectors are for this specific project. If you want to add new data collector, of course, we will use this add button. Remember to see the list. We have the filter part with a bit changes. We haven't any date here, but we have a location, and we can filter volunteers based on supervisors, because you will see when we are adding a data collector, we should assign a supervisor to that data collector, and that supervisor should be already assigned to this project. So these jobs and this workflow is very important here. We are defining a project, assigning supervisors to that project, adding data collectors, and assigning supervisors to those data collectors. And we can filter based on other things here, as you see. If we want to add a new data collector, we are clicking on add. Here you will say, okay, I want to have a data collection point. As mentioned before, for example, in CMC projects, you will have a oral rehydration point, which will be a data collection point. Or you want to have a data collector, which is a human, and sending reports based on health risks. You will see you have some information here: name, sex, phone number, which is very important. Please enter valid phone number. If you want to enter 2 different phone numbers, that's possible here. Then data collector can send report from both phone numbers if they need to do that. Here we are assigning the supervisor to the data collector or volunteer. This is important. We should select a location for data collector. This location is not a live location. No, it's just a point inside area that data collector or volunteer is active, because we want to know the report is coming from which place, which location, because we want to have act on these reports. We will see later when we are escalating, when reports are converting to alert, and we are keeping the reports and escalating alerts. We want to do some acts after alert escalation. some relevant people from Ministry of Health or health facilities are going to do a follow-up on the alerts. So we should have the location and know the estimation of a location. When you're selecting a region, you will see the districts under that region. You will select the district, then you will see the villages under that district. You saw where we defined all these levels of locations inside NIS application. Everything was in geographical structure in setting of National Society menu. By adding village, then you have ability to select the place of village by doing a click on the map. We can go inside the map. For example, here everything is just for test. For example, the place is here, let's say. Then you are clicking on that point, you see the lang and lat of that geolocation will show here automatically, so you don't need to enter lang or lat here. But you should have a point on the map, because you saw in different places we have the maps and we want to show the points on the maps. So we need to have lang or lat, the exact geolocation. After entering all information, we are clicking on save information. So yeah, this is data collector or data collection point definition part in NIS application. You will see list of already defined data collectors or data collection points. Here you saw here we have pagination, so sometimes you should go to second page to see other information or return back to first page. Here you can see all information together. So remember this pagination, which is important here again. And we have a good functionality here, which is export to Excel. If we click on this, let me do that just to show what will happen here. You will see we will have a Excel file here. If we click on that Excel file, then it's already opened in my other screen, by the way. Yeah, we will see the information of all data collectors here, and you have ability to edit it or use it for different purposes. So this is export for data collector information. You see we have ability to export to Excel or export as a CSV file. We have two more options here. One is a map overview. We can see an overview of all data collector in the map. I am just changing the zoom of the map because it's just a test. National Society with lots of separated information, and you can change the date range to see the map. You see here, if I click on this, you will see different data collectors who sent report. If I click on these items here, again I can see other information here as well. And you see this sign means the data collector in this area did not send any report in the last week. So this is the point for that. If we see a red circle with a white cross, it means that the data collector is sent incorrect report. If we see a green circle with a check mark inside it, it means that the data collector is sent a correct report for last week. So in the map, maybe we have the functionality. I don't know if it's useful or not, but yeah, here for example you see this data collector sent a correct report for last week. So it's working based on information of last week. If we change the date Of course, we can change the range of information we see here. It will be a bit more information. Yeah, let's go to the next item, which is performance, and very, let's say, more useful in compared with the map overview, because here again we can see the performance of a data collector in last 8 weeks in general, and you see again the same signs as incorrect report or correct report or not sending report. Here we can see a number of days since last report. You see here, for example, this data collector sent report 13 days ago, let's say. This is data collector part. Let's go to the next part, which is reports. I forgot to mention here again, we have export to Excel and give us another, let's say, type of data collector information or data collection point information page, which is based on performance, and you can see a graphical view of status of different data collectors in different dates and different epi weeks. Let's go to reports. In report we have 2 items, correct report and incorrect report. Incorrect report means a data collector or volunteer sent us a report with, let's say, incorrect format or wrong health risk code or other kind of error may happen. If I click on incorrect, we can see a list of incorrect report. For example, yeah, here you see, and you see what is the case, what is the error type. In this case, for example, the report is correct, but the health risk code, which is number 9, is not defined in this project, so it will be an incorrect report. Or here we have wrong reporting format, because okay, 4 is fever and rash, 2 means a female, but 5 doesn't mean anything. Here we should have 1 or 2, that's it, nothing else. So this is a wrong reporting format from this data collector, from this location. Let's go to correct reports. If we go to correct report, again, please remember the filter part. We still have it here: start date, end date, location, and other items. We can have 4 reports, and we will see a list of reports based on the filter part. You see in the table, for example, here this data collector in this date and time sent a report for acute dural disease for a male which is 5 years or older, and we have just 1 report for that. Here the health risk is sent, which is acute dural disease, again for a male under 5 years old. And we have some information here. You see, for example, here we have 0 activity reports, and yeah, this status for reports is very important. It means that not cross-checked. It means that a manager or a supervisor should come and cross-check this report. This report is not cross-checked. What does mean cross-checking a report? It means that contacting the data collector or volunteer who sent this report to the platform and ask a bit more about it or get more information about it. to make sure that the report is a true report, not a false report. Again, here we have pagination, so we can go, for example, in page 6, and it's better to use these filters here. For example, I want to see the just kept reports in this date range. You see all these reports are kept, for example. We want to see not cross-checked. To do the cross-checking job, then you will see not cross-checked report. You see in not cross-checked reports, we have zero activity reports, which we don't want to see. We can come here to the filter part, very simple and easy, unselect zero activity reports. Then in the list, we are not going to see zero activity reports anymore. So that filter part is helping a lot. Again, remember pagination. This is report part, which is very important and very useful. You can export the report list to Excel. You can export to CSV. You can send a report here on behalf of a data collector or a volunteer, manual report. If we want to cross-checking a report, for example, this report, Mary, the manager, wants to cross-checking this report. Mary, the manager, is going to call this data collector in this location and ask, okay, what was the case? What did you see? Can you explain a bit more? Or sending a picture, for example, via WhatsApp or other, let's say, communication applications, and get more information about it. And after that, we have 3 dots here, which open a small menu here for us. We can say we want to keep this report. It means that this report is a true report, or we want to dismiss it. It means that it's a false report. For different reasons, we don't want to keep it or follow up on that. This report is sent for acute dural disease, and let's say I want to see reports for fever and rash. Very easy. I will come here and just select fever and rash from the list and show results. Then I will see all reports which are here based on fever and rash health risks. Next part is alerts. If I click on alerts, we will see a table here. This is alert table. We have again a filter part on top of it. You can change based on date, location, health risk, or event, which you will see here. And all these health risks are added to this project. And alert status. So we will see here we selected all, so we will see all different status. Again, we have pagination, so by going to different pages we will see different information here. Remember, everything here is based on filter, so we will see information in this date range. We can change the date. For example, just we want to check August. We can select the date range for August. In the August, we have just 2 open alerts here. If I select, for example, this one, I will see the details of the report which created this alert. As mentioned before, we have alert rule or alert threshold for reports for health risks, actually. So based on that, the NIS application is creating alerts automatically. The alert threshold or alert rule for fever and rash is just one report. So we already have just one report, and here we can see the specification for that report, who sent, from which location, in which date, time, and what is the report for. It's a fever and rash for a female with age range under 5 years old. And the supervisor who has been responsible to acting on this report is this person, and this person is already cross-checked the report because it's kept. But the person should already taking care of alert escalation. So when we are keeping a report and everything is done by cross-checking process, after that we should think about alert escalation. This report is kept. It means that the report was a true report, so we can escalate alert. If I click on escalate alert, it means that I want to send a notification for some responsible people. Who are those people? Let's go to setting escalated alert notification recipient. Those people are actually being defined in this part. We currently have a couple of them, but you can add new people here. Enter a role, organization, the email address. Please enter correct email address because it's very important. We are going to send email notification after alert escalation for these people. So enter email address correctly. If you enter the phone number, we are sending a SMS message to the person as well. So if you enter email and phone number, the person will be notified in two different ways. It's very helpful. Let's return back to alerts. Again, I can see the alerts for this range. If I select an alert, for example, this alert has a report and it's not cross-checked yet. The report is sent by this data collector with this phone number from this area in this date, in this time, and the case is sex unspecified or age unspecified, but it's a fever and rash case we see here. The data collector can send a report with 3 parts: health risk, sex code, and age range code, but they are able to send just health risk code, just 1 part report, so that's possible. Then we will say the report is sent for unspecified sex and age, but the supervisor or the manager can contact the person and ask about the detail of the report, and we decide, okay, we want to dismiss this report. Okay, we can say dismiss. You see the status of report will be dismissed here, or by clicking on this reset we can return back to the latest situation and say, okay, I want to keep it. If we say keep, after keeping a report, the escalate alert button will be shown here. Again, we can reset and change everything here. If I say keep and click on escalate alert button, I can see who will be notified after alert escalation. And by clicking on escalate alert, the notification will send to these email addresses, and the SMS notification will send to these telephone numbers. All information here are test. I'm not going to escalate it, but in real platform it's happening there. Okay, if we escalate alert, let's say I want to escalate alert, you see the status of alert will be escalated. Then we can do further follow-ups and we have a part, its name is event log, and we can record all, let's say, events after alert escalation. For example, what was the public health action taken? And you can select, for example, referral or isolation or other things, and you can enter comments here. So this part is for follow-up after alert escalation. Or you want to record an outcome for this alert escalation. For example, a case positive lab happened, and you can enter comment, which is a free text here, and you can change the date and time and select the correct date and time, of course. Let's return back to the alert. Let's say we have an open alert. Yeah, I want to find an open alert, with not cross-checked report under it. If I open the report, I will see the detail, and Bob supervisor usually is responsible to cross-checking incoming report by data collectors, which are defined under his supervision. So if the Bob, for different reasons, can't cross-check a report, we have in setting another item here, unhandled alert notification recipient. We can say other people being notified. You see here the description. After 25 hours of the date and time we received the report, after 24 hours. If the responsible supervisor if responsible supervisor is not going to cross-check the report, or for different reasons can't do that, haven't time, or they are busy with other things, because sometimes it's happening. So we can choose other people to be notified about this alert, and cross-checking the report under that alert. So these unhandled alert notification recipients are defined here because of that, and it's very helpful. It was a quick introduction to the NIST application, and remember again, we used a manager user to check the NIST application. I'm going to logging out right now and enter with information of let's say supervisor. I will enter information for Bob supervisor, and I will enter the password here. And after entering the information in the same platform, test platform, you will see this is the interface for supervisors inside NIST dashboard. And the supervisor is entering to it a dashboard of a specific project, because supervisor is responsible for a project. We can't assign one supervisor for different projects. Other things are as before. Supervisors have access to alerts, they have access to reports, they have access to data collectors. Not all data collectors, just data collector who are defined under their supervision. They have access to health risk events. Here they can see the health risk event, they can change anything. Changing health risks and other things is responsibility for the managers. They have access to the dashboard, and they can change the information in filter and get more reports and more overview of the project. They can see the correct reports. They can send the report, export to Excel or CSV. They can see the information for data collectors. You see data collectors here. The supervisor is Bob supervisor. So Bob can't see, for example, the data collectors under, for example, Simon supervisor. It's not possible. And I'm logging out from here. It was a brief introduction to NIS application. Hope it has been useful for you, and if you have any question, please contact admin of NIS application. Thank you so much. We hope you learned about CBS and NIS application. Please reach out to us if you have any questions or need any support. Thank you all for listening.